started doing traditional canaloplasty straight out of fellowship and adopted the procedure early in my career. I performed approximately 400 canaloplasties up until a time when we started to develop ab internal canaloplasty. I started doing ab internal canaloplasty approximately 1 year ago, and my team and I have performed approximately 200 canaloplasty. We've been very excited about the results. I've been treating a number of different patients with ab internal canaloplasty over the last year. My practice encompasses a broad range of glaucoma from mild, moderate to severe glaucoma. I've been performing the procedure primarily in moderate to severe patients because it's primarily my patient population, but I have been performing ab internal canaloplasty in mild glaucoma patients as well. Over the last several months, my team and I have gone back to do a chart review to evaluate the efficacy of canaloplasty. And what we found is in those patients that had uncontrolled intraocular pressures prior to surgery, we've been able to effectively reduce their intraocular pressure to approximately 8 millimeters of mercury. We've had patients whose baseline intraocular pressure on 2 to 3 medications began at 21, and we've been able to drop that pressure to the low teens, to the 12, 13 area. In addition, we've also been able to effectively reduce their medication burden by approximately 50% in those patients with uncontrolled glaucoma. We've also had a subset of patients that have had controlled glaucoma going into cataract surgery who are on several medications. The goal of the surgery itself was not to reduce the intraocular pressure, but to maintain their pressure and reduce their medication burden. And in these patients, we were very successful in eliminating the medication burden by 100%. This patient population is now medication-free. In addition to performing ABiC in a combined procedure with phacoemulsification, we've adopted the procedure as a standalone procedure. We've performed that procedure in many patients who are phakic as well as pseudophakic. We've also had some very exciting outcomes. We've been able to reduce a patient's intraocular pressure by approximately 8 millimeters of mercury, just as we have in the other subset of patients. So we've taken a patient population that were typically going to have filtration procedures, and we've been able to avoid a filtration procedure by rejuvenating their natural drainage system and effectively increasing their natural drainage system outflow. When I approach a patient that is in need of some form of treatment to reduce their intraocular pressure or medication burden, I like ab internal canaloplasty because it's a very minimally invasive procedure and it's very atraumatic. So the patient population that we can use this procedure for is very broad. I really like to use it in monocular patients because, again, it's a microinvasive procedure and is a very low-risk procedure. When I think about doing a filter in monocular patients, I typically worry about postoperative recovery, postoperative visual rehabilitation. With ab internal canaloplasty, knowing that the recovery is almost immediate, I'm less concerned about that, especially knowing that I'm also going to get a very good pressure reduction. There are certain patients in which we cannot perform ab internal canaloplasty. It's contraindicated in patients that have narrow angle glaucoma as well as neovascular glaucoma. The introduction of ABiC or ab internal canaloplasty has absolutely changed how I approach a patient. In the past, I was performing about 8 to 10 filters a week. With ABiC, I'm using it as a primary procedure, and because of its efficacy, I'm only having to do a filtration procedure approximately 1 every 6 weeks. Looking at time saving, when we're talking about patients that need filtration surgery, there's a considerable amount of follow-up care. There's a lot of intervention that needs to take place, and sometimes we actually say that half of the surgery is done in the operating room and the other half's done in your chair and your lane. With ab internal canaloplasty, we're able to treat these patients post-operatively very similar to cataract surgery. We see them at 1 day, 1 week, 1 month, and then we see them as often as we need to after. But the post-operative care is very simple, and it really reduces the amount of chair time that you need with the patient.